India's mortality for heart attack increased from 48% to 61%. Myself, I'm Dr. Ranga Reddy, consultant interventional cardiologist working in Apollo, Jubilee Hills, Hyderabad. So let's talk about heart attacks. So heart attacks is increased in prevalence nowadays recently in the young adults. As in my regular practice, I'm seeing at least 3 to 4 young adults who are coming with the complaints of chest pain, breathing difficulty, palpitations, and dizziness. So on a day-to-day practice, as the age grows, we feel like the heart attacks only will be seen in adult patients, mainly more than 65 years or 70 years. But nowadays, due to the sedentary lifestyle and increased stress in the work environment, we are seeing a lot of young adults who are undergoing through a lot of stress, and these in turn is causing the heart problems. So the regular checkups where the patients are generally coming more than 45 years age previously, now that is 1 decade less. So we need to start looking for the heart diseases, cardiovascular diseases and stroke prevention, and diagnose the risk factors mainly in the patients who are having a significant family history, and parents who are having the heart condition, strokes below 60 years of age, they need to have a regular check even at 35 years of age. So regular checkup is very important to diagnose the heart attacks, and even when you're having the minimal symptoms like chest pain, breathing difficulty, you need to consult a physician or a cardiologist and look for any further evaluation or treatment basis, whether it's really related to the heart or if there is any other signs and symptoms related to the other conditions like gastric condition, like atypical chest pains, musculoskeletal pains, and even pleural pains. So these should be differentiated from patient to patient. Mainly evaluation through a doctor is very important. So coming to the diagnostic part, so how to diagnose a heart attack? To diagnose a heart attack, mainly first you need to consult a doctor if you have symptoms like chest discomfort, chest pain, even the pain radiating to the neck, back, shoulders. All these symptoms, the pain related symptoms may be related to the heart. So you need to evaluate this firstly by going to a physician or a cardiologist by taking at least an ECG. And the other symptoms like shortness of breath, palpitations, dizziness, nauseating feeling, all these symptoms are also associated with heart attack. So immediately go to a nearby clinic or hospital and take an ECG and run some few blood tests, and then at least we'll understand if there is an ongoing damage or ongoing heart attack. So firstly, diagnosing the heart attack with symptoms and the basic tests like ECG, 2D echo, biomarkers, blood tests, these are the main important factors to treat further. So if there is an acute heart attack, like we say it ST elevated MI, acute coronary syndrome, so you need to undergo an intervention like coronary angiogram, emergency primary angioplasty, and opening the block, or if there is any clot, we need to give some thrombolytic agents, anticoagulant agents, remove the clot and maintain the circulation to preserve your heart muscle. Heart muscle, the only muscle where if it's fully damaged, you cannot revert it back. All the other organs, maybe they'll have time to get recovered, but heart muscle is the one thing where immediately within like 3 to 6 hours is the golden period. First 1 hour is a golden period. Mainly if you immediately rush to the hospital and it was diagnosed with an acute heart attack and you go for the intervention and your vessel occlusion got relieved through a stent or balloon or thrombolytic agents, then your heart muscle is preserved and you will have a healthy lifestyle in the future. Quality of life is also very important than just living for the life. So quality of life depends on the muscle capacity. So the LV function, we say like heart pumping capacity. So heart pumping capacity mainly depends on the vascularity which supplies the blood to the heart, and even there are other risk factors where you need to prevent, mainly dyslipidemia, diabetes, obesity, other risk factors like smoking, alcohol, and healthy lifestyle. So this plays a very important role. Healthy lifestyle plays a very important role in young adults. So regular exercise, maintaining a healthy diet, doing a regular activity, and other than the regular your work scenarios and work stress, so outside the work environment you need to have your own time for your own health benefits. So this plays a very important role for your day-to-day life and your future benefit. So coming to the treatment part, so heart attacks mainly, as initially if we diagnose as early as possible, the treatment of the heart attacks will be easier even for the patient, and the longevity of the heart muscle viability. So the treatment, there are, like, once you get a heart attack or any heart related issues, consult the physician, consult the cardiologist, and they start with some basic medications based on the extent of the disease and based on the extent of your heart viability. So initially some people, generally we see, like, once they get heart attack and we treat with the stents, medicines, medications, then later they'll feel like so everything is normal, so we can stop the medication. So that's the compliance of using medications is very important in heart patients, especially young adults. So they'll be more prone because of their active lifestyle and because of their dietary habits, and the compliance is, if it's not good, then the recurrence of the heart attacks is very high. So in general population we see the recurrence when the compliance is good. The medications which we regularly use, the compliance plays a very important role. So, and the regular checkups also, even after any healthy, if there are no symptoms also, the regular checkup plays a very important role. After the treatment of the heart attack, after the discharge, you need to regularly check your heart viability, your basic ECG, your lipid profiles, your blood pressure, sugar levels, and other minor things. For young adults, what all I want to say is, prevention is better than cure. In your regular routine habits, you make sure your health is also very important, and healthy heart is much more important than the stress you take, than the seek of future advances, than the other orientations in your life. So better to diagnose any severe cardiac conditions or any risk factors. Don't ignore the risk factors. Try to diagnose as early as possible. Try to prevent it. Try to maintain a healthy lifestyle, and try to reduce the risk factors and avoid the risk factors as much as possible, and treat whenever you find if any difficulty is there. Diagnose it and treat it properly. Consult your physician. There is no problem to go to a hospital more times than having something which is obscured. So please take care of yourself. Have a healthy lifestyle. Have a healthy heart.